Welcome to the George Washington University. We will now begin our conversation responding to online mis- and disinformation and increasing trust in public institutions.
All right. Welcome, everybody. My name is Peter Loge. I'm the director of the School of Media and Public Affairs here at the George Washington University. Welcome to Jack Morton Auditorium, or as we like to call it, our living room. Thrilled tonight for you to join us for what I think is going to be an important and interesting conversation. I want to thank all of you for coming, members of our team, the staff, faculty, alumni, and friends and members of the public health community here in DC. Mostly, though, to the students. Thank you for coming out. You know, it's easy in Washington to go to almost any room at almost any time and find an interesting conversation with interesting people at think tanks or brown bags or salons or whatever. But only GW and SMPA have GW and SMPA students. And people like Dr. Califf, people like Senator Booker, Governor Cox, and others come here because they want to talk to you, which I think is pretty cool. School of Media and Public Affairs has 400 undergraduates, half of whom are majoring in political communication, half of whom are majoring in journalism, another 150 undergraduates minoring in journalism, about 70 graduate students earning graduate degrees in strategic communication. They're supported by 25 full-time faculty, about 24 part-time faculty, 3 fellows, half a dozen centers, projects, and institutes, half a dozen full and part-time staff, and outside National Advisory Council, and as of very recently, a podcasting studio that is being overseen by a Latin Grammy winner, and of course our television studio. So we think this is a pretty cool place to be. One of the coolest things about it is if you call and say, I'd like to have an interesting conversation with you, you call people and say, can you come and have an interesting conversation? In my experience, they often just hang up on you. But if I call and say, I'm the director of the School of Media and Public Affairs, they take the call, especially when those are people you know. So I am thrilled this evening to be joined by 2 people I think you will agree are smart, interesting, and thoughtful. One of whom I've known for a while, the other whom I'm getting to know. And I'll introduce them and we'll get right to the conversation. Dr. Robert M. Califf, reading his official bio, so if you have complaints, not my department. Dr. Robert M. Califf was confirmed as the 25th Commissioner of the U.S. Food and Drugs. He also served in 2016 as the 22nd Commissioner, and immediately prior to that as FDA's Deputy Commissioner for Medical Products and Tobacco. He spent a good portion of his career affiliated with Duke University, where he served as a professor of medicine and vice chancellor for clinical and translational research, director of the Duke Translational Medicine Institute, and was the founding director of the Duke Clinical Research Institute. He's had a long and distinguished career as a physician, researcher, and leader in the fields of science and medicine. He's a nationally recognized expert in cardiovascular medicine, health outcomes research, healthcare quality, and clinical research, and is a leader in the growing field of translational research, which is key to ensuring that advances in science translate into medical care. On a personal note, he's one of the most dedicated, kind, thoughtful public servants with whom I've had the honor of working. We worked together a bit in 2016 when Dr. Califf asked me to be a senior advisor. Integrity begins to describe Dr. Califf. Further down the line, Aaliyah Guzman, SMPA, political communication major, class of 25, also reading your official bio. Third-year student in SMPA, studying political communication, minoring in sociology, summer 2024 PR intern at a federal agency, and a legislative intern for former legislative intern for Congressman Sean Carson of Illinois, member of GW Association of Black Journalists, and director of diversity, equity, and inclusion for the Student Theater Council. I have to say, these bios don't begin to do either of these people justice. I could read all of Dr. Califf's bio, but we only have until 7. And Google Aaliyah. Very impressive young woman, very impressive young woman. All right, so with that, shall we?
Sure enough.
All right. A couple of weeks ago, I asked my students, what one question would you ask the Commissioner of the U.S. Food and Drug Administration? You have one question, what would you want to ask? And one young man said, when will you stop lying about what's in our food? That's a terrible question for a lot of reasons, not the least of which is Dr. Califf isn't going to say, you've caught me, and mic drop and walk off. But it does raise a broader question of trust. So Dr. Califf, why do you think a bright, curious young person studying advocacy would ask that? And how do we get to a point where the question somebody asks isn't premised on the FDA being dishonest?
You said we only have till 7. I mean, I'm not sure why he asked the question in exactly the way he asked it, because of course there's what you're really referring to is a matter of trust. We could go down the path of technically the FDA doesn't tell you what's in your food. That's done actually by the companies that make the food, and they have a requirement that they list what's in the food. And but I think there's a bridge between those two in a way, and I'll start with the somewhat more technical part. Knowing that there are 15 different things in your food at certain concentrations doesn't give you the editorial issue of what does it mean? What does it mean for your health? And I actually spent a good bit of time today talking with Tom Vilsack, the Agriculture Department leader, about the very complex issues of how to make an interpretation. And we'll probably get into this later, but you're aware that we're in very high levels of court decisions right now about whether the FDA should be allowed societally to have an opinion, as opposed to just listen to facts and let people decide for themselves what it means. But then you ask about the trust part of it, and my observation is that in our society, people have been losing trust in institutions for a long time now. I can always say, well, we do better than the press, actually, in government agencies, if you look at the polls on trust. But there's an interesting thing I was looking at it today, and again, I'll try to keep it short because I know there'll be follow-up. If you look at health misinformation and who people trust, the closer you get to somebody you know, the more they trust the same information. So in a recent poll of Americans, even those who were most distrustful of government agencies trusted their doctor, nurse, or pharmacist. And of course, the information you're going to get from a well-trained doctor, let's say at GW, is going to be pretty close to the same information that we're going to give. But it's not being given by an inanimate, vilified object. It's being given by a human being that you know. And then I'd say the other key thing, again, maybe to explore more deeply, that's a huge issue right now. There's a lot of money to be made by sowing distrust. And if you look at the social media scene right now, there's a great description from a Stanford study that basically says, we're lost at sea and there is no rudder. And so giving boring, reliable information is not a way to reach people. But we're sort of caught right now, as I say, because we may not even be allowed to give opinions, much less make it interesting. And the case that's in play, just to sort of bring it home, we put out a tweet. This is right before I arrived at FDA. I had worked at Alphabet for 5 years, so very aware of, between my 2 FDA stints, very aware of what motivates people and how they're influenced. But we put out a tweet that said, don't be a horse, don't be a cow, don't take ivermectin, stop it. And it went viral. It had a huge impact on people. But we got sued by a group of doctors that said we were interfering with the practice of medicine. The doctors won in the first round, of course in the Fifth Circuit, which is Texas. And now that's been elevated to a higher level decision. And the statement in the court was basically FDA should give the facts, not an opinion. But you could see that just using simple techniques like are used in advertising, you could have a huge impact on the public health if you were using for social good and not for evil.
So you consume a lot of this information, right? The kids today and their tics and their talks, right? But you also do social media, you do comms.
Yeah.
You're consuming this information, you're trying to make good decisions, you've got a lot of good reasons to distrust the government. How do you do this? How do you navigate it? What do you think?
Yeah, I think a lot of it comes from being informed, and this is a room of incredibly informed people who can process media in a really smart and intelligent way. But I always try, at least when I'm working on something, to think about it from the perspective of someone who does not believe in reading into the media in any capacity. I think taking yourself out of the very, DC, SMPA way of breaking down everything you look at and looking at the angles and the twists and the turns that they're going to put you through, and taking a step back and saying, if I just saw this tweet and I didn't have any reason to trust or distrust this person, what does this tell me about this agency or this group of people? Because for most Americans, that tends to be how they take things on, fully by just what you say and do. And there's a lot less digging into things than I think I had anticipated.
So I want to push on this a little bit with a bit of historical context, right? It's tempting to think that everything was puppies and rainbows until Twitter and the current political moment and the wheels suddenly came off. But we've been swimming in medical disinformation from the beginning. In the 1790s, the president of Yale, sort of the GW of Connecticut, you can kind of think of it that way, a guy named the Reverend Timothy Dwight, publicly wondered about the connection between a yellow fever outbreak and the global Illuminati. George Orwell, who among other things collected pamphlets, described pre-revolutionary era pamphlets as basically the social media of the day. They could be short, long prose, they just had to be polemical, right? So isn't this like just more of the same?
Well, I mean, it's as old as sickness. It goes way back before America that preying on people who are sick or afraid of being sick has been a business for a long time. And then you really get into people who are not just preying on people, but may actually believe a theory which is different than the mainstream. So, I mean, I would just say, yeah, it's been around forever. What's different is someone with no expertise can now reach 1 billion people. Remember that one of my favorite things about Alphabet is Google has 10 products that reach 1 billion people a month. And so you don't have to know anything except how to get on the internet in order to express an opinion that can influence enormous numbers of people. And as you pointed out, how's the person on the other end supposed to distinguish the person that has studied it, understands it, has tested ideas, has gotten critique, may have actually generated evidence about what works and what doesn't? How's a person supposed to distinguish that from a person who said, I thought about this today. That microchip in your vaccine, you better be careful about that.
So what do you think? You've got to both break through the noise, but you're also swimming in noise. How do you sort through this?
At least for me, in the work that I've done, I think people trust people and they have more respect for institutions that they feel like they can put a face to. Whatever that face may be, you saw a lot of that success come from a lot of the work that like the social media around the vaccine and Dr. Fauci did, which is it's one thing to say get vaccinated, and it's another thing when people really deeply feel like they know the person. And whether they actually do doesn't really matter as much as feeling like they can trust someone, because big government entities, I think, can be very scary for people to trust because historically they've only had an okay track record of being really honest with people. But individual people are much more trustworthy to like the average consumer. So at least in my work, I do a lot of humanizing and trying to make big government agencies that are, hundreds of thousands of people really feel like small, almost like family establishments where you can know all the players. Because when people feel like they know those people, I think there's a level of trust that then can be worked to really influence opinion.
What do you think, Dr. Califf? I mean, you said that folks trust their doctors and their pediatricians. Is it about putting a face on the FDA? Do we put you on the road?
Well, it's interesting if you look at Mandy Cohen now, who recently was named the new leader of the CDC. She's taken that very seriously. She's been on the road, almost every state, a lot of personal appearances. I think she's very good at that. For me, that's probably not the right approach. I like talking with people, and I like medical and university audiences like this one. But the truth is, even as good as Mandy is at it, she's only reaching a very limited number of people out of a country of 340 million. So I prefer to think, in what I would call the good old days for me as a practice, I was a cardiologist for 35 years and practiced intensive care cardiology. there was sort of an organized system. People wanted to, we were very involved in the treatments for heart attack. And you did your studies, you got the evidence, you took it to FDA, the FDA approved a product and the labeling for the product. That information was transmitted to doctors and nurses and pharmacists and then displayed out in an orderly way. Now, what we learned as the internet took over is that over half the country was left out of that. It was very orderly for people like me, but it was not orderly for people who didn't have access to the centers that were really plugged in. So the internet brought us ubiquitous access, but I could literally sit there at Google and see, in the sense of traffic, people leaving the doctor's office Googling madly to figure out what the hell the doctor was talking about. And so now you go, we sort of have gotten a new problem for the old one. The advantage is everyone can now get access to information, but they can't necessarily figure out what's reliable and what's not. So I think what we've got to do is to really, and one other study to mention that I found fascinating, primary care docs now are just as influenced by whether they watch Fox or CNN as the public is. If you look at docs that are prescribing ivermectin, they're docs that watch Fox News. And so I think we've got to reestablish that relationship. And I think everybody here knows we're not just talking about doctors, we're talking about the team, nurses, nurse practitioners, pharmacists, the other public health people, and they've got to amplify in terms of those interpersonal connections. But I'm still not sure that can beat TikTok.
So, Aaliyah, I want to suggest not only do we have to build, but it's not, like there's a lot of reason for a lot of communities in this country to really distrust the medical profession, not just Tuskegee, not just Henrietta Lacks, but decades, centuries of ignoring communities of color, treating communities of color as experiments, people left out of clinical trials, not thought of in clinical trials, not enough people in clinical trials. So this isn't just the rebuilding the trust from before TikTok. Like, you've got to rebuild trust, legacy trust.
Absolutely.
You consume this media,
Yeah.
these media. How do you break through? What would work for you to say, you know what, I got this? And not because, oh, I spent some quality time with the commissioner of the FDA, he seems like a good guy, but like, what would make you trust an institution like the FDA?
Well, I think trust is something that is earned and at this point needs to be rebuilt. So it comes from also ownership and really taking a step back and recognizing the ways in which those communities have been hurt, as opposed to just kind of pushing past them and saying we can rally forward without acknowledging what comes before. And then kind of what the commissioner was saying, the people that they trust, these communities tend to be the people they know most dearly. So making sure that those people are really armed with the information they need. I think that you see a lot more nurses and nurse practitioners who look like their own communities. And they're a huge asset to be able to rebuild that trust in the medical industry as a whole, because they're the feet on the ground and they're the person at your bedside when something's going wrong. So I think it's kind of plugging in with those people who really have the ability to reach communities that are otherwise left behind. And TikTok, to more or less of an extent, can help do that. But the real priority needs to be repairing the damage that was done, admitting the damage that was done, and then from there, really reaching into those communities and saying, how can we best support whatever it is that you need?
Let me up the game just for a second here,
Excellent.
Peter, because you referred to what I call the old language of disparities,
Okay.
which is still very, very pertinent. Everything you said is important and something that we need to do. But who's the most mistrustful right now and dying because of it? It's rural white people. And it shows up in all the polls if you look at who's going to get vaccinated and who's not. There's been a real hard effort in the minority community to rebuild trust, at least as it relates to vaccine. And it was not completely successful. Still a lot to do, but vaccination rates got pretty good compared to what people expected. But people go to church now and are told not to trust the government. Those vaccines will kill you. And we are at a loss about how to deal with this emerging component, which is tied into religion and other issues that we don't usually think about having to get into. So I don't, you know, I wish I didn't have to talk about this, but I think to be fair, we've got to acknowledge these new trends that we're seeing that are quite worrisome in this country. I mean, right now we have had a flattening. You know, we had a decline in life expectancy. We have the lowest life expectancy of any high-income country now in the U.S. And the biggest decline is in white men that live between Arkansas and West Virginia. So we got a lot of work to do on so many fronts.
Well, I know that one of your priorities coming in this current round as commissioner was fighting mis and disinformation. We've talked about online, we've talked about TikTok, but it sounds like social media is part of the problem. We've got really much bigger issues we have to handle here. Is this an FDA thing? Is this an all of a society thing? Is this Aaliyah and her classmates thing? What do we got like 40 minutes, and I'm feeling pretty, a little bit of despair here. So what do you got?
Well, I want people to feel despair because they should be motivated to wake up and do something.
So what do you want us to do? You got a room of smart, good people. What do you want us to do?
What I'd say is, of course the FDA is imperfect and it has to work on this, and we're working hard. I'm not asking for pity, but we have constraints. But I think this is an all of society issue. We're in a country, who would have thought, with a decline in life expectancy and the worst of any high-income country, we're spending $4.3 trillion for the worst healthcare outcomes. And it's not because we don't have the best devices. One great thing about being FDA commissioner, everywhere I go in the world, people say the U.S. is number one in inventing new things. But we're the worst in using the things that we have. And people's opinions and the effect of misinformation is profound. So it doesn't matter we have a vaccine that reduces your risk of death and hospitalization by between 50 or 80% for COVID if you don't get vaccinated. It doesn't matter that, the number one cause of death, my specialty, cardiovascular disease, we have like 5 or 6 things that are highly effective in reducing your risk. And people take dietary supplements instead. And, or we know that tobacco kills you and that vaping gets you addicted, but it happens. And you better believe for all of those things, there's an industry out there using every trick in the book in terms of advertising and influencing the way people think. It all boils down to how do we make decisions? What influences that? And there's a famous Lancet article about drug advertising that makes the point that the purpose of advertising is to bypass the cerebral cortex and reach the hippocampus of the brain, where subjective influences reign. So I think everybody in this room, last I looked, I was a 35-year university guy. Universities were created to find the truth and to teach it. So I think every university student and faculty member should be engaged with family, community, finding the truth and promulgating it among people and not staying quiet about it.
So you come here, difficult place to get in, prestigious institution. It costs several arms and several legs to be here. And the answer is apparently not better tech, not flashier, we're doing atonement for Crossfire being taped here for a number of years events, but it's going home and knocking on doors and talking to your neighbors. It's just old school. What do you think?
I think there's a place for both. I think there's space for both really effective social media campaigning and really effective communications. But there's also, I think, a responsibility that maybe a lot of students, especially students of color in SMPA, feel to kind of go back to where you came from and be a force for good. And I think everybody in college at some level or another thinks that they want to be a force for good, especially at a school like SMPA. So I think there is really an importance of, okay, I'm going back into a community that already trusts me because I'm from this community, I know these people, I was raised here. But also thinking about the ways that community isn't just physical places you're living, but where you're trusted beyond that. So even looking into the social media spaces you sit in and being like, if you're a trusted figure in a Reddit or a Discord server, you have real potential to reach people, and community is not just going back necessarily to your hometown and knocking on doors, but it's also like leveraging the communities you're a part of outside of physical space, because those same tactics of kind of reaching people and talking to people one-on-one still exist in an internet space. So you don't lose it, you just gain more communities that you get to be a part of that you can influence.
So I want to come, I'm glad you brought it back to social media a little bit, in part because we do a lot of that here with the Institute for Data, Democracy, and Politics, a project in ethics and political communication. Online mis and disinformation is in the title of this talk, so I feel some obligation to talk about it. So there's Harvard's Chan School of Public Health has a project where they've brought in TikTok influencers who are influencers on mental health. And these aren't psychiatrists or docs, these are influencers, right? They brought them to Cambridge. They showed them presentations and studies and best practices and said, please just integrate these messages into your TikToks about mental health. It wasn't prescriptive, it was, this is your online community, these are your trusted messengers. Just make this part of what you're talking about. Is that sort of along these lines? I'm not asking for medical opinions, obviously. This isn't is this what you're?
I think there's some value in kind of repurposing the kind of two-step flow model of communication that we all have to sit and learn.
All the faculty in the room caught that. She's name-checking two-step flow.
I think there's value in it because the world, especially online, is much more structured in a way where there are people who are leaders, and regardless, even when you look at people who are news influencers, who are not journalists, but have millions of people who trust them to gain information, there is value in making sure those people may, albeit interesting and unusual people to be sending a message, but if that's a way to get, sometimes millions, billions of people hearing really important and accurate information, it's worth at least leveraging. If it doesn't work, the worst they did is make a couple bad TikToks, but if it does work, you can have profound impacts on people's ability to get the resources and the help they need, especially in fields like health, where knowing information is the key to keeping you safe.
What do you think, Dr. Califf?
I think it's good and worth a try. I wish the government could do it, but we actually can't right now.
Well, let's talk about some of these constraints, right? I mean, there's all these things one could invent, right? We'd turn off the cameras and the lights, we'd sit in a classroom, whiteboard a bunch of stuff. But you are really heavily constrained by law, by judicial decisions, by statute, by all sorts of stuff. So what kind of levers does the government have to pull? Let's talk about the limits of what we can do, what you can do.
Well, I think right now we can talk about it. We can lay out the facts within the areas where we've traditionally given opinions, like risk-benefit of a drug or a device. In areas of food, what's on the label, what's considered healthy and not healthy. Those are broad areas. We can do that, but we can't tell social media people what to do. That's clear right now from the courts. We can try to communicate better with people like you mentioned to give them suggestions, but it's up to them, obviously, what they want to do. But I want to come back to universities, like, what is GW doing? I mean, you got some schools and stuff, but given that the truth is being, information is being absorbed by people in this new way, what is the university doing to have a major presence for the people that live in the university's community?
No, that's a really good question.
I think every university should really be thinking about this.
I think we're trying to, and that's a very fair point. If you look at trust issues across the board, those of you who read my stuff, and obviously you're in Dr. Trombl's classes or Professor Heinemann or a bunch of others, know that the public trust across the board is down in everything. Higher ed, public health, federal government, courts, you name it. Some of it's historically earned, some of that's more recently earned. A lot of it is for partisan political gain, and you can see that in the partisan divides. Pew Research has really good analysis of partisan divides on levels of trust. I have to say, I'm really glad to be on a stage where I'm not the only guy footnoting my comments. It's a pleasure to be back talking to you. So one question is, and we ask here in SMPA a lot, is how do we increase that trust, right? And I think we're asking you and your classmates to ask better questions, to think more critically and clearly, to put out better information.
There's something I've been thinking a lot about lately. I was always comfortable as a doctor. One reason I was attracted to both intensive care cardiology and FDA is you have to make decisions with imperfect information. Person's in front of you in the intensive care unit. You can't say, I'm going to go away and think about this for a few weeks, and after I've figured it out, I'll come back. You got to act, and not acting is actually acting, because a person may be dead before you do anything in that case. FDA, we have statutory reasons why we have to make decisions with the information at hand, but there's a characteristic of information which I found easy to transmit in the one-on-one doctor-patient relationship, or one-on family, of the uncertainty involved. You may have something that's 55-45 in terms of probabilistic reasoning about expectation, and you've got a reason why you have to make a call. And that means there's a pretty high probability that it's going to change. And you can say that, but it's, you got limited space and time. And in a one-on-one thing, you'll sit down and have a conversation with the patient and family for the time that it takes to do it. Very hard to do that with 340 million people. And so while it's easy to relate that to the pandemic, where a lot of decisions had to be made with imperfect information, the same is really true for almost everything we do. We're dealing with probabilities where major decisions need to be made with a vast amount of uncertainty that's hard to express. And so I love the old statement, the best way to build trust is to act trustworthy. Okay, so then you get to what is acting trustworthy in these circumstances with so many different expectations.
So how do we do, I don't want to let the commissioner's question about universities go by, because I think it's super important, especially given where we are and who we claim to be. So what can we do better at universities, at GW, but also across the country, at building trust in the institution of higher education and in the institutions on which we rely, like the FDA?
That's a great question. I think, at least within the institution, it comes from the way, I kind of like what you said, Commissioner, about acting trustworthy, and we talk about this in ethics all the time, but some part of it comes from a top-down approach of how the people who are in front of the camera or in front of the classroom act and behave. And when you set an expectation of really fostering a conversation of truth and honesty, even when that honesty includes uncertainty about something, it sets not only an example, but a tone for how students, and then students who eventually leave those classrooms and go out into other classrooms and the general GW community, interact with one another. So I think a lot of it comes down to finding ways to ensure that we are seeing examples of that behavior. I think it's easy to distrust when there are a lot of conflicting opinions, or when there feels like there's being information withheld. I think a lot of the online misinformation and disinformation that comes from people's feeling like somebody's hiding something. And it looks really bad if someone is actually hiding something, even if it is for the greater good. But on a level of GW that comes from administration, both like general administration, but even within SMPA, really setting an expectation of, we might not have all the answers, here's the best answer we can give you right now, updates to come kind of mentality, at least allows students to know and feel like there's a level of honesty, because no one really gains anything if it's an absolute answer that then gets taken back in a couple weeks. So I think on that level, kind of fostering an environment where it's okay for uncertainty to exist in our colleges and our universities makes a world where we're okay with uncertainties existing. And I think that fosters a really productive space.
What do you think, Dr. Califf? You're the one who raised the university question.
I think it's a good start, but I mean, I'll tell you, I see universities in a lot of places that are intimidated by their board of trustees right now when it comes to things like vaccines and effective medical treatments. A lot of the big donors are not necessarily, they have their own opinions about what should be done. And, you know, you guys are expensive. I don't know if you noticed, but
No, we're reminded of that routine.
so you need a lot of philanthropic donations. You don't want to make those donors angry. I see a lot of that right now in universities, and yet the mission should be to seek the truth and promote it. I think we're not quite there at this point. Now, how to organize. I'll mention one other thing about universities I think is really important. Funding for programs to study this issue. It sounds like you're doing it here. But if you look at universities or you look at the NIH and say, what's the funding going into the study of how to relay scientific information, when we know that in the US we're creating all the tools for the world in terms of drugs, devices, biologics, et cetera, but it's that next step where we're failing. It's crazy that we don't have more university programs that attract smart people to get into this game, because none of us know exactly what to do now.
Well, it's also that the members of Congress and some of the members of Congress and pundits and others are actually going after those researchers, right? I mean, one of the effects of distrust is public health officials around the country are quitting in droves, election volunteers are quitting in droves, researchers of online mis and disinformation get death threats, right? So it's not just like we could do more, but there are people who are actively undermining it.
Death threats are part of normal life in the world I live in now at multiple levels, and real threats, not just online threats. So security is a big issue for people that are brave enough to speak out, and it's got to be done. I do, just to try to not make it completely too serious, but how many times do I sit through hearings where a person from Congress says, you know, you guys are not trusted by the public, you're terrible, nobody works at the FDA, you're lazy, you don't do anything good, and by the way, nobody trusts you. And I want to say, after what you just said about us, no wonder. And counteracting that is really hard to do. I always hold back from saying we actually have a much higher trust level than Congress does. Congress is actually the lowest of any organization in the US right now. But that wouldn't go over well, so I don't ever say that, of course.
It's okay, we're in a safe space. Actually, the first member of Congress I worked for used to say you can't burn down the house and expect to occupy it. I wouldn't attack the institution for that reason. But I'm going to push this a little bit further, even more than specifically with the FDA. And this comes back to conversations you and I had in 2016. One complaint people have about DC is it's a super small town. And people rotate through universities to industry, to think tanks, to talking heads, to government, and back and around and through. And part of that's for good reason. They're experts. If you're an expert in medical devices, there just aren't that many jobs for you. It makes sense to have people in industry know what the regulatory world looks like. But others criticize this as regulatory capture, and it can be easy to point out and say, well, of course you, right? I remember your first confirmation hearing. But one of the things that you and I used to talk about is judgment, trust my judgment. How do you persuade people that, yeah, I've worked in industry, but I'm not beholden to industry. Yes, I've worked at a university, but I'm not waiting to get my cushy job back. How do you get them to trust your judgment as an administrator and a public health leader?
Yeah, of course, keep in mind, universities are regulated entities.
Yes.
And a lot of things like the food here and the medical center are very much part of FDA regulation. I mean, it's a choice that has to be made by society. There's a view, I'll just offer the two extremes. There seems to be a view among some people that work at FDA should be people that have never had other experiences in the world, who sit behind a desk, don't talk to anybody except themselves. And some company comes and tosses some data over a transom, and they read it and make a decision. The alternative view is that there's a body of knowledge underlying medical products, food and tobacco which is rapidly evolving, especially now, very scientifically complicated. You talk about gene editing now, where we have hundreds of potential cures for rare genetic diseases that are completely untreatable. You're talking about dead children who can now live. But to understand gene editing, you can't just have sat behind a desk. You actually have to have lived in the biotech world some to know how it's done. And so the key thing under, my view of the equation is that when people sign on to work at FDA, not as political appointees, but as civil servants, they have to be free of financial conflict. And they have to live in a system which is highly regulated internally in terms of how decisions are made. There's no single person that makes a decision at FDA. You know this about a medical product. It's done by a team of people who are constantly interacting with what's the word for it? Something about dissenting voices, so that anybody on the team that disagrees leaves a record, which is a public record. So, and then political appointees like me don't make decisions about individual products. We deal with policies. But I would argue my record is a pretty public record. You can decide for yourself. But fundamentally, I just believe that if you think that regulators can regulate something that's complicated without ever having lived in the world or having finished their job without ever going back to working in that world, I just think that's a bad way to do it. That doesn't mean there have to be watchdogs. There has to be a public record. Transparency is critical. And when things go awry, which they sometimes do, it needs to be dealt with.
So would that make you increase trust in government? Part of the great things about SMPA is these revolving doors rotate through here, right? Former government officials or speakers and fellows and faculty and adjuncts and all of that. You're now in this churn. What would make you trust the judgment of, I'm not going to put you on the spot with Dr. Califf, but with other government officials, CDC, Federal Communications Commission, FAA, whatever?
Yeah, I think part of it comes down to making sure that everyone kind of knows elected officials and also the people who do make these decisions. I think one of the most interesting things is when I was telling all my friends, half of my friends were like, what is an FDA commissioner? Like, with full seriousness. And these are college educated, but these are college educated students at not a random school who should probably know this information and should know who that person is, because they help make decisions that impact our lives every single day. But I think it comes from very much this mentality that the only people that make decisions is Congress, or that the only people that make decisions are the president. And I think that's a belief that's widely held. So I think part of the issue, especially if you want people to trust, is knowing who they're trusting, like knowing the name, knowing the face. That really makes more of a difference. I have found in my own work, working comms and working PR, even working on the Hill, that people knowing the person, even just as a name, as not as just an entity, really helps to foster that trust. And I think the other thing comes down to finding ways to make those processes for how decisions are made a lot clearer. Just because something's a public record doesn't mean people can find it. I think there's a lot of work that's done to keep public records not easily findable, because then there will be people like, C-SPAN people who kind of just watch it all day. And if that wants to be the choices that they make, that's their decision. But I think a lot of the trust thing comes from making sure people can really access all of the resources that they have that are offered to them by them being public records, by these being people who you can look up on the internet and know. But encouraging people to do that outside of just the scope of universities, but regular Americans. So when they're concerned about an issue, it doesn't have to feel so scary, like there's this giant regulatory entity coming in to tell me how to live my life, but rather that there's this team of people who've come to an educated decision.
I think that makes a lot of sense. And of course, we're about to enter a whole new world with generative AI.
That's coming to that.
I mean, being able to aggregate everything that's out there. Of course, working at Alphabet, I could see it coming in
Thanks for the
we
heads
could-
up, by the way.
we
It
could-
would have been helpful had you given us a couple of
we could
heads up.
aggregate a lot of things there very quickly, and turned out to be very useful during the pandemic. A lot of the COVID tracker stuff that you saw was actually being done behind the scenes at Google by software engineers who could scrape the internet. You'd be amazed at what's publicly available if you can know how to get it. But now you're just going to tell your AI assistant, go find everything on X, and it'll show up. Then we got to figure out how do we regulate that, and of course it can hallucinate, and there are all kinds of issues we'll have to deal with there, but it won't be the immediacy of information that you're referring to, which I do think is an issue. Yeah, just for the audience, I mean, the other thing I think is critical just to know as you think about the FDA in particular, I think the best analogy for FDA is the referee. The FDA actually doesn't make the rule book the rules are actually made by Congress in the form of laws. So it's your elected officials that are making the rules. Much like if you're refereeing a college basketball game, you're a referee, but there's a rule book and your job is to interpret the rules. So that's where the latitude does exist. But those referees, you don't necessarily know the names of the referees, do you?
Right.
But there's also a sport in the U.S., and there's a great podcast about this by, forgotten his name, but a well-known author, that points out that vilifying referees has actually become a major activity in the United States. And what he pointed out was most interesting about it to me is that if you look at the athletes who go after the referees, it used to be the worst athletes. Now it's the superstars who go after the referees because they somehow feel entitled that the rules shouldn't apply to them. And this author made a real analogy there to what's going on in our society. But, you know, and civics, of course, and I don't know what happened to civics in junior high school, but it seems like it's not being taught so much now. But some of these basics, it would be nice if people started out with a foundation.
I want to shift gears on AI a little bit. You've talked a lot about AI over the past year. Members of Congress are raising concerns about AI and are urging FDA to weigh in. You've been on the Hill talking about this. FDA has issued guidelines on AI and machine learning software, medical devices. The public is skeptical of AI. Part of it is the hallucinations, part of it is the fake broadcasters, part of it seems scary. So you've got low confidence in AI, you've got low confidence in public health institutions. How do you persuade the American people that your work in AI in medical devices is trustworthy and good? Because the opportunities are exciting and thrilling and could be literally life-changing for lots of people.
This is one where I actually disagree with your premise. I understand that if you ask people in the abstract, do you trust AI in government? You know, it's obvious what the answer's going to be. But if I asked you, do you trust your Apple Maps? You'd say, yeah, because I've used it, and it actually, I can get to where I want to go faster and better if I use that than trying to stop and pull out a map out of the glove compartment and, you know, get confused to have a wreck because I'm looking instead of just having the darn thing talk to me. Well, what do you think is allowing that map to function the way it does? It's AI in the background. And there's a lot more AI in the everyday life now than people know. And I think for hardcore medical devices, as you know, it's highly regulated and will be regulated like other hardcore medical devices, which is, by the way, is imperfect because devices can go wrong and it's not easy. But there's this whole other area of AI on decision support, which is where I think the action is going to be. It's just my favorite study of the day, just came out. Kaiser Permanente looked at, you know, the biggest, having been a practicing doc, it really pisses me off to think about the life of a doctor or a nurse right now. You spend 80% of your time typing into a computer. Patients are unhappy because you're not looking at the patient when you're trying to, well, Kaiser Permanente gave the docs an AI buddy, and it reduced their administrative work by 80%. Wow. And the patients loved it because there was actually a doctor-patient interaction going on instead of a doctor-computer interaction. But imagine that you walk in with a symptom, your doctor doesn't know what it is. The entire world's literature will be at that doctor's fingertip in 10 seconds with a list of options of what this could be. There's just no question that's happening. And I'll just say one of the mantras in the alphabet world is if you give people something usual, it's amazing what they'll give up to get it. You have to give them something they actually want and they find useful. And but once you do that, you've got a huge social responsibility to make sure it works. And how to do that in generative AI, you know this because it's been written about, but the leaders of Google and Microsoft and Amazon have been in to see us saying, please regulate us. And we say, okay, how do we do that? We don't really know. We can't explain exactly why generative AI gets a mind of its own and comes up with these amazing insights, but it doesn't. So we're all going to learn about that part of it.
So you go to the doctor, there's a little AI buddy. I just saw that look on your face. What do you think? Is this more, I mean, on one hand, you're getting more one-on-one attention, right? The personal attention you talked about being important. On the other hand, there's this, AI buddy helping provide medical care.
I mean, generally that's a positive thing. You want people to get the support that they need. I think a lot of the distrust will come from what exactly AI is trained on, and there is so much research and debate about that. But AI can hold the same prejudices that the things that it's aggregating information from can. And that, especially in the medical field, is a concern for a lot of people who have a lot of really poorly done research saying this or that about their communities. So at least from a personal standpoint, I would be a little uneasy for sure. And that's not that I don't trust the medical professional, and it's not that I don't trust the doctor, but AI is built off of information we already have, and that information that we already have is imperfect at best in a lot of ways. So I think what really needs to happen there is an opportunity for a little bit more, and it's hard to do with the way that AI is trained, but more transparency about exactly where they're getting the medical information that they're using and where it's coming from is really important to, I think, getting kind of buy-in from people who are going to be just inherently kind of averse to it.
Let me respond to that because I don't disagree with what you said at all, but I would add this to it, two things to add. It's almost like we're unfairly picking on AI because everything you said is true of the current situation. We're dependent on, if you go see one doctor, whatever is in that doctor's brain, that doctor's experience and what's in the literature, heavily biased. And by the way, is operating in America's healthcare system, which is uniquely built to create disparities. That if you disagree with me, just let's have a discussion about that. The system is structurally built to advantage people that have money and are highly educated. And if you don't believe that, look at where the investments in why are cancer centers built like Four Seasons and addiction clinics? You got to really look to find them, and they're not typically very well supported. And I can go on and on about this. So you're right that AI is picking up data from a system which is inherently biased, but we're not fixing the system. The system's actually headed the wrong direction right now. If you look at health outcomes, the disparities are widening, not declining. And your doctor's experience and the research that's done in the current system with the quaint methods we've been using really reflects that bias in ways we can't explain. Now here's the potential good thing. And I think it's twofold potential for AI. Number one, a lot of the reason we have biased research is because the gatekeepers of what research is done are institutional officials who are protecting the financial interests of the institution. Now, I'll use a non-charged issue from my early experience. In the 1970s, we had a computerized database. No one else had it. It was amazing. And we were just dealing with one thing, coronary artery disease. And one of my colleagues for the first time, was able to look in the computer and lo and behold found out that at Duke we had a high surgical mortality for left main coronary disease. And he took it to the chief of surgery. Chief of surgery said, "Thank you very much, you're fired." Because you didn't want anyone knowing that you had a high mortality. But if you look at, what are the health outcomes within 10 miles of this place? And where's the money being spent? I sort of rest my case on that one. But if AI has the possibility of bypassing the gatekeeper, so the truth could be exposed whether people like it or not. And I think that's a very real advantage. And in the same way, when it comes to planning interventions, people who have not had access to the data, because it's typically locked up for health data within the people that control the health system, people that have not had access to the data could get access now because the tools of AI can bypass a lot of the things that are blocking data right now. So maybe it's a good way of saying you should be in despair, but there's a real opportunity if we do the right things to fix some of these problems in ways that we just can't right now.
That's well timed. We're going to end on vaguely optimistic, even though you should feel despair. Take what we can get. It's 2024. Any last thoughts or questions, Aaliyah, before I give the last word to the commissioner?
I guess my question would just be, is there anything you feel like the students of GW, the people who will be walking the hallowed halls of Rayburn very soon, should know when they're going into these fields and talking about mis and disinformation and public trust?
I would probably just repeat try to pithily say what I've said before, which is you're in a powerful position with the education that you have. I think you have a social responsibility to talk to people around you who may not have the time or the education to decipher some of the things that they're being exposed to. And I will always add to it, hold your bosses accountable for their behavior. And people are often afraid to speak up, and there's a price to pay for speaking up. But a lot of our future is going to be determined by decisions that are made as these technologies roll out now in such a world with so much uncertainty and such a different way that we're all interacting with each other.
Excellent. Any other final thoughts, Commissioner?
No, I'm glad it's good to be in a university again. It's a little different.
Different shade of blue than the one you're used to, but we got something.
Oh gosh, yeah. Let's don't talk about shades of blue right now. A very sad night, Saturday night in Chapel Hill, but that's all part of life. There's always the next game. But I just think I think it's hard for people to realize how direct the relationship is between bad information, bad decisions, and death. And I talk about death because I'm a cardiologist. It's life and death. But it really, and you can see it in our populations of people who are consuming bad information or making bad choices, and they're dying earlier. I like seeing my grandchildren, and I want to see them grow up and graduate from high school. But a lot of people I know are not going to do that because they've been misled. And we have a responsibility to do something about it. In addition to developing fancy technology, I'll just throw one thing. I'm not sure TikTok should exist. I think you'll hear more about that soon. Who is actually controlling the algorithms in TikTok? You ever figured that out? But so fancy software and computers is very important, but the interpersonal part is probably most important.
Excellent. Aaliyah Guzman, Commissioner Dr. Robert M. Califf. Thank you very much. So before you go, if you liked tonight, and you did, that was sincere, February 21st, 4 p.m. on this stage, the Sesame series continues with Disagree Better, how politicians, the public, and the press can turn down the heat with Utah Governor Spencer Cox, Jonah Goldberg, editor-in-chief of The Dispatch, and more. February 27th, 6 p.m. in the studio, TV studio upstairs. We have a TV studio. It's pretty cool. Campaigns, and we're doing our event with campaigns and elections, mobilizing the rising American electorate, how young voters and people of color will shape the future of politics and campaign outreach. And on March 1st, in the lower lobby at 1 o'clock, SMPA's first career and networking fair. I don't know what you're planning after the FDA, but we're having a career fair downstairs. If you want.
Golf.
Golf. I can't help you there. Thank you, Dr. Califf. Thank you, Aaliyah. Thank you to the GW events team, Ebony Smith, David Jocelyn, our SMPA student ambassadors, Lucy Gardner, Katrina Hauser, Sarah Morissette, and her invaluable, incredible team. Thank you all very much for coming. We'll see you again.